So, you're ready for more. It's going to be exciting. So, what we're going to be doing now is we're going to be looking at that terminology. So let me move through where we were before. So when we were talking before, we were really getting an idea of the organization of the body. We looked through the different body systems. We talked about how things are organized in the body, those different organizational levels. We talked about the requirements of life and how that kind of matches up with our different body systems. And we talked particularly about homeostasis. So that was a big one. So if you didn't understand that before, make sure that you go back and review that and know the difference between, again, negative feedback and positive feedback. Okay, so the second portion of this chapter actually continues on, and we learn some of the language of anatomy and physiology. So anatomical position and directional terms. So one of the ways to kind of just imagine how this is going to be relevant, not only, like we said, is it a language, both a spoken language and a written language. So remember that correct pronunciation of these terms and correct spelling of these terms is going to be critical. So if you, sometimes it comes out where it's just one letter difference and it makes a big deal. So for instance, if we were to think of, let's say, the bones of the leg. So if we think of the bones of the leg, we've got this one, the tibia, and we have this one, the fibula. So the tibia is your shin bone, if you will, from the age-old song, and the fibula is on the lateral side. We'll talk about what that is, and that's a skinnier bone. And when we look at those two, right, if you were to have a fracture or something like that, it would be very important if you were writing it down for your patient to write down which bone was fractured. And let's say you just had a spelling error, just a slip, one letter, something like that, and you did this. You wrote that down in the chart, and now the person's like, who's reading that chart after you, is like, I don't know. Looking at that term, it could be either bone, right? It's exactly halfway between those two terms, and all you did was change one letter. So, oftentimes, one letter isn't quite so critical, but you can see that can be the case sometimes. So spelling, and like we said, and pronunciation is going to be important. So one of the ways that you're going to be using this quite often is, like we said, charting, when you're not there to explain exactly what was going on with your particular patient. And so when your patient is there, if they came into you and they were sitting up or something like that, and now the next shift comes in and that person's laying down and maybe they're sleeping on their side or something like that, well, what if we're talking about, oh, okay, there's something on the, the upper surface of the body. What do we mean upper? Is it like up by the head, or is it just the upper part of the body because they're sleeping on their back and this is the upper part, or are they sleeping on their side so this is the upper part? What does that mean? So we need to have a standardized way of communicating, and that also starts with a standardized way of, if you will, orienting the body. So we all picture the body in one particular way, which is called standard anatomical position. And that's with the body erect, standing up, feet slightly apart, palms facing forward, like this, and the thumbs pointing away from the body. So with that in mind, then we can use other terms, directional terms, as to where things are. So like if you're talking about on a map and you say, oh, well, Gilbert is just, east of Chandler by like 10 miles or something like that. Well, we know those directional terms, north, east, south, west. And so by comparing two things, you can say where it is relative to the other one. So directional terms work like that. So it's always based, though, on standard anatomical position, not were they lying down on their stomach or whatever, but standing up. I can't quite stand up, with your arms out to the side, your palms facing forward, and your thumbs pointing out to the side. And here's another critical aspect as you get into it. Remember that as a healthcare provider, it's very important that you are thinking of your patient all the time. So you are always talking about, if you're talking about right and left, you're always talking about the right and left of your patient. So I don't look at that person like looking at you, and I'm not like, oh, okay, this is my right side, and they have a problem over there, and so that must be their right side. Well, that's actually your left side, right? So you always have to be writing things down. You always have to be referring to them on the patient itself, not yours. Unless you're specifically describing, you're the patient. Okay, so here are some of the directional terms that you need to learn. And luckily, a lot of them are paired. And so, like up, down, and left, right, and things like that, front and back, we're going to find that these are often paired. So for instance, one of the first ones we have is superior and inferior. So superior, you know, if somebody's feeling superior to somebody else, right, they think that they're above them, etc. So superior is going to be kind of up towards the head, kind of up above. Again, anatomical position like we see there. Inferior is going to be the opposite to that, right? So my nose is superior to my lips. Likewise, you can say my lips are inferior to my nose. Now, anterior and posterior. Anterior and posterior basically means front and back, right? So anterior and posterior, that's my posterior. I got my posterior kicked, and this is going to be the anterior on this side, okay? Now, you'll notice that sometimes we have terms in parentheses as well. So these are terms that you can use that can be exchanged for the other term, right? They're synonyms, basically. So cranial is also used for superior because it's up towards the head. Caudal means tail. So depending on the time of year, it may have just gotten through Shark Week. And so when you think about a shark or something like that, they're caudal fin, marine biologists. So, you know, I got to bring those things in every once in a while. Caudal fin is the big tail fin, right? Likewise, if we think of a shark, when we talk about a dorsal fin is on their back. And so the dorsal surface is also the same as the posterior, and the ventral surface is also the same as the anterior. Now you can choose which one makes more sense to you and have that be your primary ones that you use, but you need to know how they translate as well. So if you like anterior posterior, then you need to know if somebody writes down dorsal, right? There's a cut on the dorsal surface, you need to know that dorsal means posterior, okay? Okay. Medial and lateral. Medial and lateral are the next two. And we're talking about towards the midline of the body or away from it. So, medial. So, like if we're talking about our eyes and our nose, right? The nose is medial relative to the eyes. The eyes are lateral relative to the nose. Okay? So, medial and lateral. And then intermediate, as the name would indicate, is kind of somewhere in between. Proximal and distal. Now, proximal and distal are kind of like superior and inferior, but they're referring to the limbs. And notice, right, in anatomical position, even though, you know, things are kind of vertical, etc., there's kind of an angle to them as well. And so as we get out on the limbs, we often, rather than just using superior and inferior, we use proximal and distal. And so distal is kind of at a distance, way out on the limb. Whereas proximal, if somebody's a close talker, they're in close proximity, right? That's going to be close. So we're talking about closer to where that limb attaches to the body. So for instance, if you're talking like the elbow and the wrist is distal to the elbow. Meanwhile, the elbow is proximal to the wrist. Okay? Likewise, when you talk about the digits, right? When you talk about the bones of the phalanges, there are 3 bones out here. And so this is the distal phalanx. This is the proximal phalanx. And this one is actually the middle or intermediate, right? Because that's at a distance. That's furthest out on the limb. And this is closer relative to that. So this one's called proximal. Okay. Superficial and deep. With those ones, you're probably familiar with those. Superficial and deep, think of a cut, right? So we're talking about the depth, if you will. The depth that something is going into the body or not. So superficial is more external, and then of course deep is more internal instead. Okay, so those are directional terms where we can describe where things are, comparing one thing to another. Other terms that we have associated with the body have to do with what's called divisions or regional terms. So there's 2 main divisions of the body. We call it the axial, which includes the head, neck, and the trunk, and then there's the appendicular, which is going to include the limbs. So that really comes into play when we're talking about the bones, right, of the skeleton, as well as the muscles, right, whether they're here in the torso or whether they are on the appendages, appendicular. We also find that there are regional terms that are describing specific areas as well. And so these are going to be critical. Again, if you're charting, you want to be able to describe exactly where it is. So if we look at this, we can see that there's a number of different specific regional terms. Terms that refer to particular areas. Nasal, you got that one. Oral, you got that one. Frontal refers to, right? This is the frontal bone here of the cranium, so this is frontal. Orbital is the eye socket. Now when we see cephalic here, cephalic means head. So these are all specific little areas associated with the head. Mental, on that one's a little confusing, like brain. But in fact, when we're talking about it, it's more associated with the chin. There are what are called mental foramen right here, where we have nerves that are coming through the bone of the mandible itself. And so, anyway, mental refers to this area down here. But cephalic head, cervical neck, thoracic chest, abdominal, right? Abdomen, the gut. Pelvic is going to be this area of the pelvis. Pubic is going to be around the genitals. And then we get also into other specific areas. Areas of the upper limb, the hand, the lower limb, and the foot. So some of these have to do with the particular bony structures that are there. There's a acromial process that's there as part of the scapula up here. So that's an area of the shoulder. Brachial has to do with the arm. Antebrachial is an area here that we see along here. Antebrachial is going to be the forearm that we see here, whereas brachial is going to be the arm. And that's, even just knowing the difference between arm and forearm is something that you got to get used to, right? So from the shoulder to the elbow is the arm. From the elbow to the wrist is the forearm. They're separate, okay? Likewise, from the hip to the knee is the thigh, and from the knee to the ankle is going to be the leg, right? This whole thing here is not the leg. And here's one way to remember that, right? When you go to KFC and you order thighs and you order legs, you get two different things, right? So you got to apply that same type of anatomical terminology associated with eating to what you're learning about the body as well. So these are all different kind of specific areas that have their particular terms, right? Antebrachial, like we said, is the forearm here. Antecubital has to do with the area of the elbow here. Palmar with the palm of the hand. Pollex has to do with the thumb. Digital, the digits, the fingers. Coxal is the hip. Femoral has to do with that femur underlying the thigh. Patellar has to do with that kneecap. Crural has to do with the leg. Fibular is along the lateral side of the leg because that's where the fibula is. Tibia is here. Fibula is there. Tarsal is ankle. Metatarsals has to do with the bones of the foot. And again, the digits again. And in this case, the hallux is the big toe as opposed to the pollic being the thumb. So lots of different terms. Yes, you are going to sound so smart when you get done. So this sassy guy with no pants and the vest here, we're trying to show that this is the posterior or dorsal surface. And again, you can see some of these same areas, cephalic and cervical and things like that, but we can see other areas here now too. Antebrachial, we see the forearm there. We can see other aspects of the thigh. The popliteal is the back of the knee. So we had patellar on the anterior side of the knee. We have popliteal on the back side of the knee. Sural is the calf, like we see here. So we do see some differences between anterior and posterior. A few other things in terms of terminology associated with the whole body. Body planes, or different ways that you can divide the body. So if you were doing a dissection, right? If we're talking about a dissection, we're going to be dissecting brains and eyes and things like that. We got to be able to describe, okay, you should be cutting it this way, not that way, divided into an anterior and a posterior, divided into a left and a right, etc., right? Making one cut in different directions can be very important. And there's three most common planes or cuts or sections. One is the sagittal plane, two is the frontal plane, and three is called the transverse plane. So when we look at those, you know, these are different planes, not plane airplane, but planes, like you see a plane kind of, that where if you were doing a dissection, you could cut along that particular body plane. So a sagittal cut, for instance, goes along the sagittal section. So when we look at these are some diagrams showing us those different body planes. The sagittal section, see this plate of glass cutting through her body like this. Sometimes if you imagine like a samurai cutting through somebody, then you can imagine those cuts going through somebody, or they're walking through a waterfall and you can kind of see where the water's going. You see one part of the body and not the other, right? So a sagittal cuts the body into left and right halves. Mid-sagittal is exactly in the middle, so they're halves, exact left and right halves, or equal, if you will. But even if you did a cut here, whoosh, and you cut off her arm, kind of gruesome, but if you did, that would still be a sagittal, or what's called a parasagittal, because we'd have a right side flopping around over here and a left side flopping around over here, right? We're dividing into left and right. A frontal or coronal, you can use either one, right? A corona is like the sun, or a crown, right? A corona would be going around like this. A coronal plane or a frontal plane divides you into a front and a back, or an anterior and a posterior. And then a transverse is also known as a horizontal plane. So cutting you across this way, it could be anywhere. Cutting off your head, that would be a transverse, but anywhere along the way as well. Just a few more things associated with orienting ourselves to the body. Different cavities and membranes. What we find is there's a lot of these internal organs that work to sustain life that are part of these different organ systems, and they often are packaged in different spaces within the body. And so there are two main body cavities, the dorsal and the ventral body cavities. So, for instance, the ventral body cavity, where's that going to be? Going to be down towards the bottom, up towards the top? Ventral means anterior. So the ventral body cavity is going to be, if you will, on the front. And if we look at, from a lateral view, right, lateral view of the body, viewing it from the side, you can see all this seen in red here is the ventral body cavity. All that's seen here is the dorsal body cavity. Now, depending on the anatomist you talk to, sometimes they say that the dorsal body cavity isn't a true body cavity through development and things like that. But that aside, it is a space that contains organs. So for instance, the dorsal body cavity breaks into a smaller cranial cavity that houses the brain and a vertebral cavity that houses the spinal cord. So it's kind of like those Russian dolls. The anterior cavity, or the ventral cavity, divides into a thoracic cavity, all of this, and an abdominopelvic cavity, which subdivide, right? Abdominopelvic cavity divides into abdominal and pelvic. The thoracic cavity here divides into pleural cavities that house the lungs, a pericardial cavity that houses the heart, and a mediastinum where a lot of the different blood vessels are going through and the trachea is cutting through. It's kind of a passageway in between these others. So lots of different cavities. So you need to know these cavities. You need to know what's in each of these cavities. Okay? Okay, and another important thing, when we talk about all these organs being smushed together in these cavities, they're going to be moving around and doing their particular jobs. We don't want them to rub against each other and generate friction. So oftentimes what we find is that there are going to be these coverings and linings, these membranes associated with these organs, right? And so these are called serous membranes, not serous, but serous membranes. They're also sometimes as a layer, they're called serosa. And these serous membranes are very slippery fluid membranes that are on the surface of the organ, and they're also lining the cavity that the organ sits within. So the layer of it that lines the cavity is called the parietal layer, and the layer of it that's right on the surface of the organ is called the visceral layer. So if this is the heart and it's beating within the pericardial cavity, right? It's not generating friction here. We have the slippery membrane on both sides, on the cavity side as well as on the organ side, that allows this organ not to generate friction. So this would be called the visceral pericardium here on the heart, and this would be called the parietal pericardium lining the pericardial cavity. And we'll see that all over the place. So I gave you the example of the pericardial, and we know pericardium means heart, but we also have membranes like that associated with the lungs, plural, and Peritoneal is talking about all the organs that are down in the abdominal pelvic cavity, or a lot of them. They all have this slippery membrane to them. Lastly, when we're talking about orienting ourselves to the body, we're looking at how these, especially the abdominal pelvic cavity, where there's so many different organs in it, subdividing that so we can really describe, okay, the pain was located here, or there's a cut on this area, or there's a protrusion or something like that, right? So you can divide it two different ways, into quadrants, quad meaning four, and we're going to be doing that again and again. Get used to doing that. When you see a word, being able to break it down into its prefix and its suffix, and understanding how those things can give you hints about where it is or what it does or whatever, like quad means four. So you can divide the abdominal pelvic cavity into four quadrants: right upper, left lower, right lower. Remember, this is relative to the patient. That's why we're saying right and left in that way. Or you can get more specific and use these regions like we see here, or like you see here. And if you use regions, it's a little bit more specific, this tic-tac-toe pattern. So umbilical region is around the umbilicus or the belly button. The chondriac, hypochondriac, hypo means below, and chondro means cartilage. So when we're talking about the cartilage associated with the lungs, we're talking about, or with the rib cage that cover the lungs, it's below that. So there's a right hypochondriac region, there's a left hypochondriac region, and then there's also epigastric. So gastric, if you have a gastric bypass, what's that going around? A bypass is going around the stomach. So epigastric is near the stomach. Then we have a left and right lumbar region. That's talking about the lower back, right? Lumbar is the lower back. And then right and left iliac. The ilia are the bones, basically the hip bones. So when you feel down there and you feel your hips, right? You can feel them right down there. So we're saying right and left iliac regions are associated with those hips. And then down here in the middle is the hypogastric region. So, you know, this is epigastric, this is near the stomach. The umbilical region had its own name because of the umbilicus, because of the belly button. This is hypogastric, also called the pubic region, right in the center instead. So, again, lots of terminology. Take your time with them, make flashcards, do practice with them, just like vocabulary in your Spanish class or whatever. It takes repetition and studying to actually understand what these terms mean and begin to use them. So make sure you do. All right. So that should do it for now. That should do it for our chapter 1 as well. So, key thing about it is, remember what we just did right now? We just did the class part. So while it seems like with, you know, some of these courses that are hybrids or online, it seems like, oh, I've been doing all this stuff at home, I do all this extra homework and stuff like that. This is class time. So remember, for each hour of class time that you have at least that much study time in order to go through it and understand it and remember it as well. So now you need to move into that aspect, or come join me again for another lecture as we move into chapter 2.